Good afternoon. I'm Larry Holsey, Director of Municipal Information and Communications for the City of Waco, and I want to welcome you to the third floor of City Hall, where we're having a press conference like we've done in the past, and it's virtual, and in the room with me is maybe a handful of people. Special want to make sure we recognize our City Secretary, Esmeralda Hudson, who is again stepping forward and helping us with the WebEx technology. Esmeralda, thank you again for being a part of that. You've got one of your assistants here to help with that too. Kyle Mascarella is with us on our television department, sending the signal down to our studio, where we also have American Sign Language and Spanish interpretation going on in our studio to simulcast that. The Spanish interpretation is something that I know Councilmember Sabito has been very part of his collaborative work team that the mayor appointed. Since we are going to be replaying this at 4:30 approximately, with the Spanish translation over everything that's said, so our Spanish speakers can be able to hear exactly what's going on, I'd like to ask Councilmember Sabito, who's online with us, to express this invitation to our Spanish speakers.
Thank you, Larry. Buenas tardes. Para ayudar a nuestros ciudadanos que hablan español a comprender lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español durante esta conferencia de prensa. La grabación completa en español reemplazará la grabación en inglés en el video, y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Thank you.
Thank you, Councilman Sabito. Appreciate that. Joining me again today virtually are three distinguished gentlemen that have spent a lot of time and effort and working very hard regularly on this project as we continue on with the COVID-19. Joining us is Waco Mayor Kyle Deaver, McLennan County Judge Scott Felton, and Dr. Jackson Griggs, who is the CEO of the Family Health Center and Vice President of the Waco McLennan County Public Health District. Welcome, gentlemen. Good to have you here. Well, I'm going to outline again how we're going to do the press conference. We do have media on the line, on the telephone line, but first of all, we're going to ask for each of you. We'll start with the mayor, then we'll go to Judge Felton, then we'll do Dr. Griggs to make an opening comment, and then we'll read some questions that have been presented earlier on for that the community, I think, is interested in hearing answers to. And since the governor spoke on Monday, a lot of things have changed maybe, and we're going to clarify a lot of those things. And then following those questions, we will open it for the media that we do have on telephone. We have registered media representatives from all the four television stations, as well as the Waco Tribune Herald. And the mayor will handle that part of it, and he'll call them out by name. And if you're on the phone, please keep your phone muted the whole time until you're called on to speak. So let's get started. Mayor Deaver, would you care to make some opening comments?
Yes, thank you, Larry. Good afternoon. Thank you for joining us. 2 days ago, Governor Abbott released his report to open Texas and his executive order number 18. The governor's plan is a thoughtful, phased approach to reopening our economy, where he reopens a large number of businesses at a restricted capacity of 25% occupancy in most cases. Then we wait at least 14 days to see data from symptomatic patients, tests, and hospital capacity to see what effect the loosened restrictions are having prior to moving to the next phase of opening. I believe this is a responsible approach to trying to manage two competing goals: public health and safety on one hand versus the health of our economy on the other. When we ordered shelter in place in Waco and McLennan County, our county had a higher rate of confirmed cases per capita than any other county of 200,000 or more in Central Texas or North Texas. Esmeralda, can you put the slide up, please? Yes, sir. We also had a much higher rate per capita than the statewide rate. As a result of the sacrifices and hard work that our citizens have done, McLennan County now has a rate of confirmed cases per capita that is much lower than the state of Texas. And we have a very low rate per capita compared to all the other counties over 200,000 in population in our state. So I want to say thank you to all our citizens of Waco and McLennan County. Thank you for all the sacrifice and hard work to get us to this point. We are in as good a position as we could be entering this reopening phase of our economy. It will be up to each of us to continue to do our part to slow the spread of the disease, avoiding large crowds, observing physical distancing protocols, hand washing and sanitizing, and wearing a face covering, especially in crowded places. If we do all those things, we have a good chance of being able to continue to the next phase and the next phase after that of reopening our economy. If we don't continue to do our part, all the sacrifices that we have made over the past weeks could be lost. Look forward to talking to you about how we are going to be going through this reopening as we answer questions going forward. I'll turn it over to Judge Felton for some remarks.
Thank you, Mayor. Good afternoon, everyone. As the mayor said, it's with a very positive approach from our side of it that the governor's orders will give a little relief to our community and primarily our business people, which need the relief very much. We've got a long way to go, but we do see that we can achieve these different levels of opening up our economy and allowing individuals to have more freedom if we continue to do the things that got us to this, here thus far. I look forward to answering the questions that the media or others might have, and I think that'd be the best way for us to respond. Thank you.
Dr. Griggs?
I just want to provide updates on reported cases and testing. Worldwide and in the United States is where I'll start. There are over 3 million cases now worldwide, and approximately a third of those have been in the United States. As I'm sure you're aware, yesterday we crossed the 1 million confirmed cases mark. There are over 218,000 deaths worldwide, and just over a fourth of those deaths are in the United States. The Texas Department of State Health Services reports that for Texas, 26,000 cases have been confirmed, and there have been 690 deaths in our state. So a relatively small number of confirmed cases and deaths compared with the country as a whole, particularly given our population of 29 million in Texas. In McLennan County, I want to give an update for this afternoon. We have a total of 88 confirmed cases. We have one person currently hospitalized, and that person is in critical condition. We have 72 who have recovered, and we have 12 active cases. The health district is monitoring currently 66 individuals. And as you know, we have had 4 deaths. The total tests performed to date are 3,069 performed by McLennan County Hospitals and Family Health Center. 581 of those tests have been performed on individuals who are not county residents. We have still, thankfully, had no cases in nursing homes. We've had no new cases in first responders, so we're still at 2 total cases in first responders to date, and we've had no cases in our jail.
Okay. Thank you, gentlemen. Now, let's just get started with the questions. I have a number of them here that we've collected throughout the community, and people I think will just really genuinely want to know some of the answers to these. City officials have talked about the need for more widely available testing to safely start reopening businesses. Will local hospitals still require patients to who have traveled outside the country or be able to pinpoint the person who infected them to receive a test?
Griggs, will you take that?
Yes, sir. I confirmed today with the clinical leadership from the hospitals, and I can speak for the Family Health Center and say that none of us are including travel or close contact with a confirmed case as criteria for testing now. When we had a scarce supply early on, those were factors that were in consideration, but they are no longer.
Thank you.
Okay. A study published in Nature on April 27th states that viral RNA can remain airborne in high traffic areas with low or no ventilation, particularly bathrooms or crowded areas. What can businesses do to guard against that?
Dr. Griggs, I'll ask you to take that one as well, please.
This was an illuminating study, and our recommendation would be that outdoor air is really valuable. So leaving windows or doors open to let outdoor air circulate, putting fans in place in order to bring outdoor air in, particularly in those areas where, as we begin to reopen restaurants and retail, we're going to see more traffic. It'll be more important to have outdoor air circulating. The key issues continue to be proximity and time exposure to individuals who are carrying the virus. Again, whether or not they have symptoms, if somebody has the virus, then closeness to that person and the duration of time in which you're close to that person are the key factors. So physical distancing is just so very critical.
Okay. Earlier today, Dr. Powell said a second wave of COVID-19 is inevitable. In the event of a second wave, all businesses and places where people congregate, will they be closing again? Can the city take action as quickly as it did in March if cases begin to pick up?
I'll attempt to answer that. The governor's order made it clear that cities and counties cannot pass orders that are more restrictive than his. And so we would not be able to act as quickly as we could otherwise. We will be continuing to monitor conditions very closely. And if we see things starting to get out of hand, we will certainly let the public know. And I personally would plan to reach out to the governor and let him know that we're seeing real issues in our city, and Judge, I would think in our county. Do you have anything you would add to that?
No, I think that's exactly correct.
Okay, thank you.
Okay, the governor's order and the information we received, he was talking about phase 1, phase 2, phase 3. Describe the criteria that must be met in order to advance from phase 1 to phase 2, and the city's plan maybe that'll take over maybe May the 18th.
Well, so we're not operating under a city or county plan at this point. We're operating under the governor's statewide plan, and he's given every indication that he plans to continue to take control of the state and not allow local control. So we're operating under the governor's plan, and as I said before, I think the governor has presented a reasonable plan and a smart approach. But what he has not told us, what he's not told the public, is what criteria he is looking at or will be looking at as we consider moving from phase 1 to phase 2. I will tell you that his plan is not very dissimilar to the plan that we were beginning to develop here locally in case we were given local control. And we had phases as well and tests that had to be met in order to move from phase to phase. And we were looking at things like symptomatic patients, number of positive test counts over total test counts, and then also looking at hospital ICU bed availability, total bed availability, ventilator availability, those kinds of things, to be sure that the hospitals maintained capacity and weren't becoming in danger of being overwhelmed. That's what I think the governor will be looking at. Those were the kinds of things that were in the President Trump's plan that he put forward for states that was largely, I think, built by Dr. Fauci and Dr. Birx. So I would think that's probably a lot of what the governor will be looking at as well.
Okay. Speaking a little more about the governor's specifics, in the governor's reopening order, how is it going to affect funerals and memorial services?
Judge Felton, would you try to address that?
Well, funerals are recognized as like a religious ceremony, and so those are allowed. I think the funeral organizations, associations have set out criteria for the funeral directors that are sensible and safe for those people attending. As you can imagine, funerals and even like weddings are areas that a virus could transmit through communication, close proximity, and those things. So I would suggest that people are arranging for funerals that possibly look at a memorial service at a later date where you can, where more people can be involved in. But right now we are, we very much recommend that you keep social distancing and a large amount, a smaller amount of people to attend.
This question probably is kind of in that same line, maybe more specific. Will there be a limit to the number of people who can gather in one space? Is there something you can put a number on?
Larry, I think that's one of the biggest questions that people have, and it's one of the most confusing. The order that the governor issued on Monday did not change anything regarding gathering or social purposes. You still are not supposed to be gathering in any group outside your household for social purposes, except that he has carved out certain things, such as, we believe, weddings and funerals that could take place because they are considered essential services or essential businesses. And so it's confusing. And what I would say is it's still really important for us to not gather socially. And there may be some very, very specific occasions where it is okay under the governor's order. But when we do that, if you do that, you must still be very, very careful to avoid getting closer than 6 feet from people that are outside your household. Continue to wash your hands and consider covering your face.
You mentioned that question was a very popular one, but this one is even more so. When will salons and barbershops be able to open?
I'm going to ask Judge Felton to answer that one.
Well, we hope that by the 18th that our numbers look good. You mentioned the criteria a while ago, Mayor, and we know that criteria is going to have a lot to do with the trends, that we have improving trends. We don't know for sure whether the weather makes a difference or not, where the summer months help, but we're hoping that if everyone does a good job going forward as they have in the past, that those numbers will improve. The thing I've been impressed with by the salons and barbershops and other places that are in close proximity to people, they have plans, and very specific plans on how to protect their clients. And that's going to be important, but it's back to us to be able to, as we utilize those services, that we actually grade them on how good a job they do to protect us. And of course, we've got to protect them as well. So I'm very hopeful that those things, I need a haircut. So hopefully after the 18th, we'll be able to do that. But again, I must emphasize that the business owners really work on selling how they're keeping you safe.
I've heard
I agree, Judge. Just to reiterate, that again will be up to the governor and not us, but we certainly hope that he'll feel comfortable opening those businesses in mid-May.
I've heard all three of you all brag on and compliment our citizens for the job they've done in suppressing this. So this question comes in, which is kind of in that line. Why has McLennan County's experience been so much better than places like New York City, and places that really had a big problem?
I think that requires some science, so I'll ask Dr. Griggs to take that.
New York City had a lot of silent spread going undetected before any kind of shelter-in-place order was executed, and in Waco and McLennan County, we had shelter-in-place really when spread was very, very early, and then there's a population density difference. In New York City, there's a big population in an area that is more dense than in our population in McLennan County. 56% of the New York population uses mass transit, according to the New York Transit Association, Public Transit Association. And of course, we don't have a subway or the same number of people who use our public transportation in our county. So that played a factor. And of course, in New York, there's lots of international travelers. And so early on, there were people who were importing the virus into the city, which again accounted for why there was early undetected spread. And then New York City had a lot of spread in the nursing homes and in the homeless shelters. And thankfully, we have not had any cases in those environments.
Okay, very popular question for all the press conferences we ever had about testing. Okay, is testing more available now? Who's it for? And talk about reliability. There's a lot of talk about the accuracy and the reliability of various tests that are out there.
Larry, testing is such an important topic and it's complicated. I think generally there is more testing, but I'm going to ask Jackson to elaborate on that and also on reliability.
So right now in McLennan County, we're performing just around 100 tests a day, and that's quite a bit more than we were doing 3 weeks ago. But as we begin to think about reopening, we need to expand the number of tests in order to keep a really good sense of what this virus is doing in our community. So there's a small group of us who have been kind of contemplating what's the right number for our community, and the estimate is probably closer to double or even triple the number of tests we're doing right now. Thankfully, this coincides with more availability of the test, and so I can speak for the Family Health Center and say that we are now testing all individuals who are patients who have symptoms that might be attributable to COVID-19. So if you have symptoms that may be COVID-19 and you're one of our patients, we're aiming to test you. And the question of reliability is a difficult one because for the nasal swab, that's the PCR test. There's no gold standard, so there isn't a way in which to say here's the test that's perfect, and here's how we're comparing our PCR to that perfect test. The best study in peer-reviewed literature that I have seen compares the test with patients who have had the clinical symptoms and CT evidence, so imaging of their chest that is strongly suggestive of COVID-19. And in that study, the PCR test had 70% sensitivity. So if you have the virus, the test picks up that you do have the virus 70% of the time. However, in all patients who had positive results, in all patients who had the virus, the test, when it was positive, indicated that the patient had a test. So in the PCR test, let me clarify, in the PCR test, if it's negative, you still need a doctor's opinion as to whether or not you may have COVID-19, because that negative test is not reliable. If, on the other hand, the test comes back positive, you almost certainly have the coronavirus. So that's the PCR, that's the nasal swab test. And this is different than the antibody test. And the antibody test, there are lots of questions right now about the antibody test. And so I'm going to go into a little detail about the antibody test, because in that finger prick antibody test that's beginning to be available, you run into the opposite kind of problem than the nasal swab test. So I was talking before about false negative tests when we're talking about the nasal swab test. Well, the antibody test has a problem with false positives. So let me explain. The Celex antibody test was FDA approved on April 1st. The sensitivity of the Celex test is about 94%. The specificity is 96%. So if we were trying to test asymptomatic patients in a community like ours that has probably 1% or less of the population that has the coronavirus, the test, when it came back positive, would be untrue or inaccurate far more times than it would be accurate. In other words, if we were testing asymptomatic people, we would be giving them sort of the wrong kind of reassurance that, hey, you've had this test, you're probably immune to it, you can go back to work without a mask, you don't have to physically distance, etc. That would be inaccurate and wrong advice more than it would be accurate advice. So that's why we have to be very careful with these newer antibody tests, particularly when we're testing asymptomatic people. If a medical clinician judges that somebody has a very high likelihood of having the virus based on their symptoms, the antibody test may have a role. But that's a small number of people right now in our community. So in no way should antibody testing be used in a screening fashion for asymptomatic people or be used in any kind of casual basis for mild or minimal symptoms. I think that's probably the key take home is that in this case, no information is better than bad information.
Kind of following up on the testing, one quick question. Everybody wants to be tested. There are more tests, more tests. What is expected to be accomplished when we increase testing?
So when we're talking about increasing testing, just to be clear, we're talking about the PCR test, that's the nasal swab test. And the more cases that we capture that are positive, remember that the nasal swab test, if it's positive, it does tell you the truth, that it is almost certainly you do have the virus if that test comes back positive. So if we can capture as many as possible, those cases that are positive, then we can do contact tracing and identify who all the close contacts are and household contacts and make sure that those individuals are quarantined so that we limit the spread of the virus.
Okay, as we open up the businesses, the restaurants, and things like that, masks become another topic that's very popular right now. Will masks be required as any part of this phase one?
You know, Larry, before Monday, there were several counties in Texas, including Dallas County and Harris County, that had passed orders requiring some kind of face covering when you're in public. And I think it's really important to understand the distinction between a mask and a face covering. A mask is a type of face covering, and it may be the best kind of face covering. But what these counties were ordering was that people wear some kind of face covering because they recognize the limitation on masks. I was getting emails and calls from citizens asking for that, for us to order that. And Judge Felton and I had a number of discussions about that, and neither of us felt really good about ordering our citizens to wear masks. And so then the governor's order made it very clear that any kind of order like that by a local city or county was not going to be enforceable anyway. And so we will not order that you wear masks, but we highly encourage people to wear some kind of face covering when you're out in public, particularly when you're in an enclosed place and particularly when it's a busy place or a crowded place. It doesn't take the place of physical distancing, but it still helps. And what you're doing is you are preventing the spread from yourself to others. You may not have symptoms, but you may be positive or for the disease. You may have the disease and not know it. And so it is a sign of respect to others to wear a face covering of some sort. And I normally wear a fishing buff that I just pull up and put around my face. But any kind of face covering is better than nothing. And, there are a lot of stores now that are, I know grocery stores, or some of them are requiring their employees to wear masks. And they're doing that to protect their customers. So, I think it's really important for us to think about as a society that when we go out and we go into those places, we have a social duty, I believe, to do that, to protect the people around us, including those employees who are trying not to spread it to you. And so we're not going to order it, but we really, really suggest that that's the right thing to do right now. Judge, do you have anything to add to that?
No, not really, Mayor, other than, it's all about education. There's a reason to do things, and people with good common sense ought to be able to understand if it's communicated to them properly why that's a benefit. And I think you did a good job there. It's all back to our responsibility of not only protecting ourselves, but protecting others.
Great. Thank you, Judge.
Everybody talks about getting back to normal. We're ready to get back to normal. Let's open the stores. Let's everything. Let's get back to normal. What are the city and county's goals for reopening, in addition to getting back to normal? But what are the city and county's goals?
Judge, would you like to start?
Well, obviously, we'd like to get back to how it was before this started. We have to be realistic that it's probably not going to go away overnight. It could have some lingering effect. It's just so many things that we don't know. We are fortunate in this community to have some very smart, bright people that like Dr. Griggs, that are really looking to research not only what's going on here, but comparing our data to other cities and other countries. And where some of these have started before us with the problem, they're kind of cycling through, and some of them are backsliding to a certain extent. And so, hopefully our knowledge and our research on how they're doing would help us how to plan to go forward. But I can tell you, we are all wanting to get back to normal.
Yeah, I agree, Judge. And, we want to get our economy going as quickly as we can. But if we move too quickly and we're not careful as we do it, we risk having to go back into shelter in place. And that's the last thing any of us wants. And so this measured approach that the governor is following is, by most will agree that is the right way to go at it. If you just flip the switch and start out full speed in all sectors of the economy, you're almost guaranteed to have that kind of backslide and be back in trouble. And so it is a difficult line to walk, and it's a balancing act that the governor is trying to pull off. We do need more testing, and more testing will be critical as we go forward. The governor has said we will have more testing. The president continues to indicate that we have more testing on the way. And if that is true, we have a good chance of moving forward.
Mayor, if I could add one thing, you talked about flipping the switch, and we've seen where that is actually happening across the country in certain areas, certain states. So, we'll have an opportunity to watch that. And, we're open-minded. We want to learn from this. It's our first time to do this. So we will be watching those areas and those states that have flipped the switch, so to speak, and just opened it wide open. And but we don't feel confident in making that move ourselves right now.
Thank you, Judge.
A lot of people have compared the COVID virus to a common flu that we've had, and we know that it's more deadly and things, but how much more dangerous, kind of more mortality rate? What is the problem? What is the difference between the COVID and the flu that we're used to dealing with?
Dr. Griggs, would you answer that, please?
Sure. Yeah. I think that let me go into some detail again on this, because there's a mythology, I think, that's being circulated, particularly on social media, and I'd like to dispel some of the misunderstandings. So I'm gonna explain case fatality rate and infection fatality rate. Rates have a numerator and a denominator, and if you mix and match case fatality and infection fatality rates, then you can come up with all kinds of inaccurate information. And so I think that's what's happening in large part on social media. It's just a matter of blending the ideas together and coming up with kind of squirrely information. So I'm going to kind of go through what case fatality rate and infection fatality. Case fatality rate is the numerator is number of deaths that are due to in this case, a viral infection. The denominator are the total number of confirmed cases. So it's pretty easy to calculate. The flu, the estimated kind of peak number of deaths in the United States due to seasonal flu this year is going to be around 62,000. That's the estimate. And that's out of 56 million cases. So 62,000 over 56 million. 62,000 over 56 million. The case fatality rate's about 0.1% for the seasonal flu. The current case fatality rate of COVID-19 in the United States is 5.7%. So 0.1% for the seasonal flu, 5.7% for COVID-19. So that's 50 times higher for the case fatality rate. But unlike the flu, where there's relatively few asymptomatic cases, the novel coronavirus has a high rate of asymptomatic cases. So we can use the idea of infection fatality rate, which attempts to account for all asymptomatic and undiagnosed cases of infections. So where the case fatality rate for COVID-19 might be 50 times higher than the flu, the infection fatality rate is probably closer to 3 to 10 times higher than the flu. Again, because we have so many people who are asymptomatic, who have in the United States who have the novel coronavirus. So when we're thinking about symptomatic people and we're comparing flu to COVID-19, it is 50 times more lethal. If we're talking about all people who have been infected with the germ and are comparing the novel coronavirus to the flu, the novel coronavirus is about 3 to 10 times more lethal. So, but I'm going to hit just real quickly the differences between the flu and the coronavirus, because I don't want there to be any misunderstanding. Key difference is the novel coronavirus is much more contagious than the flu. The novel coronavirus has much greater asymptomatic spread than the flu. There's no herd immunity for the novel coronavirus. Herd immunity we talked about last week, the idea that enough people in a community have immunity to the infection so that the virus can't hop from person to person to person. So there's no herd immunity to the coronavirus like there is to the flu once everyone gets vaccinated. And again, the novel coronavirus is more lethal than the flu. So please be critical readers of social media. The flu does not lead to the kind of widespread mortality. It doesn't lead to New York. It doesn't lead to Italy and Spain and having to use refrigerated trucks as temporary morgues. There's just a massive difference between the two viruses.
Okay, I'm going to combine a few questions because I want to bring this to a close fairly quick so we can get to the phone call. Talking about reoccurrence, is it expected to be a seasonal experience and maybe have multiple waves of the virus until we have a vaccine?
Dr. Griggs, can you address that?
The best thinking is that yes, and again, if remember that there's a tipping point where we reach number of infections in the community where then we just see a big explosion of spread. And so, and it's really a delicate balance to know where that tipping point is. So we start seeing a new wave, and we all have to be in this together and saying, okay, now's the time to shift our collective community behavior so that we don't hit that tipping point and see the mushrooming of cases.
Okay. Let's jump into some of the opening and closings and things. A lot of people have asked what city and county facilities that have been closed will be reopening as a result of the governor's order.
Well, we're working on that now, Larry, from the city standpoint. We plan to open Cottonwood Creek Golf Course, the disc golf course, and our tennis courts in the next few days. We think that some of our other facilities will probably need to wait till the second phase to open, but we are continuing to evaluate that on an ongoing basis. And it's, we're having to make some of the same decisions that people are having to make about their businesses. We want to protect our employees. We want to protect the public. And we're trying to be thoughtful about how we approach each one of those facilities. Judge, do you have anything?
Well, the county only owns one park, and it's on Trading House Lake, but it has not been closed. It's people go there primarily to fish, but some day camping. But we encourage people to get out and exercise and really enjoy the outdoors to help kind of get through this issue that we've been going through. But we look forward to seeing more activities like that in the future.
When can we expect city council meetings and commissioner court meetings to return to in-person meetings?
Judge, you want to start with the county?
Well, right now using like Zoom and these other tools to be able to communicate virtually have become really pretty nice additions to what we've been doing. Right now we have temporary approval to be able to meet in this way. And so we'll see going forward what technology we'll use to meet. But nevertheless, if we do start meeting with the whole court, we will use physical distancing and all things to be sure that we protect those commissioners. They're looking, they're watching out for their safety and safety of others as well. So we'll see how we look going forward.
Yeah, Judge, I agree with that. We have done these our city council meetings virtually for a while now. One of the concerns is that if you're in a room with the other council members and somebody gets sick, then you potentially have a problem where everybody has to isolate and quarantine for 14 days, and it becomes very difficult for us to do our job as city council. And so, as long as the governor has the emergency orders in place, I think we'll continue to meet like this unless we feel like we can really safely move back to a more direct meeting.
Well, as long as
let me add one thing, if I may. We still allow for public comment, and we put out information out there how if the public does want to meet before the court on business matters, that they can have a way to do it. And they can do it through Zoom, or they can do it through a phone call, or if they call ahead, there's a possibility they could even come physically in the courtroom to do that. So.
Good, Judge, and we have similar measures. We're not allowing people to come in because there's not any place for them to go, because we're not doing it from the courtroom like y'all are.
Yeah.
But we do allow comments ahead of time, and people can register to call in on public hearings. We do still expect to hear from the public and want their input on these items.
Right.
As we continue to physical distance and we're kind of isolating ourselves from the outside world, let's talk about travel a little bit. When people have to travel, want to travel, need to travel, what should we be thinking about as far as travel? And are we going to maybe look at people who have traveled back into our community in a different way once we've kind of flattened the curve and we've gotten things more open?
Well, the governor does have some travel restrictions still in place, and so I would caution people to look at his orders about that. But I'll ask Dr. Griggs to talk about the health aspects of travel.
Yeah, I would still recommend not traveling from a health standpoint for any non-essential reasons. And if you really must travel, there's some guidance that might reduce your risk of contracting the virus and risk if you happen to be one of those asymptomatic carriers sharing the virus with other communities. So let me kind of review some of those with you. For one, obviously continue to practice physical distancing. It becomes really, really important if you happen to be traveling using air travel. Being in an airport right now, keeping your distance is just so very important. Using hand gel after touching any high touch surface, or washing your hands, and washing your hands really frequently. Wearing a mask is really valuable. Again, you're wearing a mask to protect others because we don't know if you're an asymptomatic carrier or not. If you're going to travel a distance and can reach it by vehicle, by car, then use that preferentially over air travel. If you can travel by yourself or with household members, again, you're kind of keeping all of those together who have already had exposure to each other, as opposed to going to airports where you run the risk of getting the virus or sharing the virus. And pack meals on your car trip so that you don't have to stop and get food along the way. Again, limiting the number of times you come in contact with others. And when you arrive at your destination, regardless of what the ordinance or orders or rules are in that community, as much as possible, avoid mass gatherings. And if for whatever reason you really must be at some gathering with a number of other people, just be very, very careful with your physical distancing. If you're standing, if you're staying at a hotel, take some antiseptic wipes or your antiseptic spray and clean all of the high touch places in the hotel. So doorknobs, sink faucets, all of those sort of things. But do kind of be responsible for your own cleaning of that hotel room with some sort of antiseptic cleanser. And if there are glasses that are there, wash the glasses or silverware, unless it's in a plastic, already comes with a plastic wrap around it. Wash glasses and silverware in a hotel.
All right. I just have one more question, and if the mayor's back, I'm going to see if he can answer this, because I think it's a statement everybody's kind of interested in overall. We're talking about events, things like Fourth on the Brazos, the opening of the zoo, the opening of the various museums and things. I know those are things that are places that the city provides. What is the status of some of that, and what is the plan for getting any of those activities going again?
Larry, I know people have questions about that, and I wish I had good answers right now. The reality is we've had less than 48 hours since the governor issued his order, and our staff is busy evaluating all of those things right now. The zoo, I think we are likely not to open until the next phase of opening. It is an accredited facility with the American Zoological Association, and there are some considerations there. And it's complicated, but I think we'll be able to announce several of those things in the next few days.
Okay. All right. Let's, if you'd like to, Mayor, I'll let you open up the discussion with the people who've been waiting patiently online. You have the list of the names of people who have signed up in advance, and if you'll call them by name, then as you do hear your name called, unmute your phone and ask your question, and then remute you, please. Mayor?
Yeah, I will do that. Thank you, Larry. First, I want to thank everyone who sent in questions that we just got through answering. Really good questions from people in the community and the press. And now we'll have some follow-up questions from the press that are here live on the phone with us. And we'll start with Rhiannon from the Waco Trib.
Hello. My first question is, has code enforcement had to issue many more citations to individuals or businesses for violating the orders so far, like up till now?
You know, we have had very few citations that we've had to issue. Our citizens and our businesses have done a great job of complying. There have been 2 or 3 times where it was obvious that a business was sort of just brazenly ignoring our ordinance and our orders, and we felt like we had to issue a citation. But that was really, really infrequent. I'm going to say less than 5, and maybe fewer than that. But Judge, do you have any different experience?
No, we've been able to, I guess, educate. If we do have an issue, go out and our efforts in educating, and that's been working good.
Good. Next question will be from Jasmine at KCEN.
Jasmine, are you
Jasmine.
online?
In regard to, oh, yeah, I can hear. Can you hear me?
Yes, Jasmine,
We
go
can
ahead.
now.
Oh, okay. Sorry. This question is about the relief fund for small businesses affected with COVID-19 from COVID-19. How is it determined who will get those funds?
There is a committee. There's a funding committee that is made up of people from each of the chambers of commerce. There's a city representative. I believe there's a county representative that will be at each of those applications, and those applications are coming in very, very quickly today. So I don't know all the criteria that they're using. They have to qualify, and I think that's the main qualification, is that you have to qualify for those funds, and that's businesses that have been in our business for a certain length of time, that have under 10 employees or 10 or fewer employees, and that continue to stay in business till a certain date.
Yeah, it's called the Small Business Recovery Fund. And so you can go to the city's website or the county's website and link to that. So,
Thank you, Judge. Drake from KWTX.
Yes, sir, Mayor Deaver. We have a question about kind of in the same vein regarding punishments or fines for these businesses. When they reopen come Friday, with the 25% capacity, who's going to be in charge of kind of monitoring that? And how will that go as far as making sure these businesses don't go over 25% capacity and have the 6 feet apart?
Well, restaurants and certain other businesses already have a stated capacity in their establishments. And I believe we're going to be posting, if we haven't already, guidelines for those that are not in those categories and don't have stated capacities, to determine what their capacity is based on what kind of business it is, and the square footage and other components. And if that's not on the COVIDwaco.com website yet, it should be there soon. But we'll work with businesses to help them understand what the 25% or what their capacity is, and then obviously they can figure 25% from there. Our code enforcement people will then be working based on complaints to visit those businesses and help them understand where they may not be in compliance, and as Judge said earlier, try to educate them. That's what will be happening in the city. Judge, can you talk about outside the city of Waco?
Similar situation and trying to understand what their capacity is. But, let me kind of switch this back around, that really the patrons need to be the ones that look at this and be sure they're going to places that want to keep them safe. And I think we have so many good, responsible business people in operations in McLennan County that they're going to want to, like they did before, compete for that business, and so they're going to want to make those patrons feel safe, and the patrons need to be sure that they look around, see what's going on, make sure the places are clean, and go to those that provide the best safety.
I agree with that completely, Judge. I think that's the right approach, and the one that has been followed to a just great extent by most of our businesses in the county. Joel Lopez from KXXV.
Piggybacking off that same question, what are going to be the consequences for businesses who exceed the 25%? I mean, I know in the past you guys have given warnings and education to what they have to do, and citations. Is there possibilities of closing businesses down? What could they experience?
I think that would be the ultimate. That is a possibility, is for the governor to go after them with some kind of injunction to close them. But honestly, I just don't expect any businesses to get to that point. I think that our experience so far has not been anything like that. Judge, would you weigh in on that?
I've still remain confident that that our businesses here in this county will stay in compliance and be sure that their license are in good status and those kind of things.
I mean, look, these businesses know how important it is for us to move forward and get to, 25% of capacity is not going to help them that much. It'll help, but they need to get to 50% and then to 100%.
Right.
And so they're smart enough to know that if they get out of compliance, it hurts our whole effort as a community to move this thing forward in our economy. And so I think, as Judge said, we need to give our business people some credit. They know what's important here too. Shaquille from KWKT. We're not hearing you, Shaquille.
Shaquille, are you on the line from Fox 44?
Yes, Shaquille Omari here. Maybe a second round of the virus coming along. How nervous are you guys for that?
How nervous are you about the second strain coming through, second wave?
Dr. Griggs, can you speak to that?
Yeah, I think that it's a matter of when we see cases rise and not if, and so just to kind of reiterate, testing will be key in that, and contact tracing. The health district's done a magnificent job to date, and I know that there are conversations that are ongoing about how to accommodate any growth in numbers, even if it's a rapid growth over a short period of time in numbers. How can we expand contact tracing to meet the need? So I think with increased testing, with ample contact tracing, I think when that wave comes, I'm not speaking here of a surge. I'm talking about a little wave. When that wave comes, as it begins to, as we begin to see numbers climb, we can get in front of it aggressively and contain it.
Thank you, Dr. Griggs. Judge, do you have anything to add to that?
No, sir.
Okay, thank you. We'll go back around for one more round of quick questions. Rhiannon at Waco Trib. Rhiannon,
All right.
Are you there? Go ahead.
Go ahead. Go ahead,
Even after
Rhiannon.
reopening, yes, even after opening again, businesses could continue to take a hit either because of the lower capacity or because people may just avoid them. I'm thinking like a movie theater, for example. Is there any kind of help? I know that right now there's the small business grants, but is there any kind of help for a business that would continue to struggle after reopening starts?
Rhiannon, I guess I would say that we're not taking anything off the table, but there is certainly a limit to what local government can do to support these businesses. The support that we came up with for the small businesses came out of CDBG funds that were part of the CARES Act. That was part of the federal response to COVID-19. And then we called on the Waco McLennan County Economic Development Corporation, and they put in additional funding that was earmarked for economic development to help support that. So neither the county nor the city used any of our general fund money to support those programs. And we are going to be strapped, just like these businesses are, to provide the services and the infrastructure that the citizens expect from us. So I think the reality from our city standpoint is that there's not likely to be funding for that kind of thing on a wide scale. Judge, do you have any other comments on that?
No, unfortunately, this is one of these business risks that no one ever expected to come, and so it'd be hard to answer that. What lies for the future? I know that the federal government has done a lot, and there's talk about doing even more. And maybe that some of that will help those particular businesses. But yeah, this is a business risk that you don't plan for.
Agreed, Judge. Jasmine at KCEN.
Sorry, I don't have another question. Thank you.
Okay, thank you. Drake at KWTX, do you have any other questions?
Yes, sir, I do. I have a question that may be more for Dr. Griggs, but obviously if Judge Felton and Mayor Deaver want to also jump in, feel free to. It's regarding testing, and I know that Dr. Griggs, you did a great job kind of explaining a lot with testing earlier, but we have a question about a lot of people reaching out to us saying that they aren't getting tested, even though they have all the symptoms, and they're being treated and being told that they basically are positive for coronavirus. You said you had a good feel for how we are doing in the area, but if those people aren't being tested, might there be a lot more coronavirus positive cases that we don't know about?
Thank you, Drake, for that question. When we had very scarce tests, we were prioritizing the most health vulnerable, and we were allowing those people who were coming in who were young and middle age without comorbidities, who had symptoms, even if we thought for sure this person has COVID-19, we were not testing those individuals. Instead, we were giving them instructions: self-isolate, be fastidious with your self-isolation, don't come in contact with anyone. We were notifying the health district. But now we've shifted into a time where testing is more available, and there should be fewer and fewer of those cases. I don't want to speak too broadly, but at the Family Health Center, we're trying to really make sure that we're testing everyone who we think may have symptoms that indicate COVID-19. So, and my sense is that that's the trend across our community. Again, I'm trying to be careful not to speak for other healthcare systems, but I know that we are collectively increasing our number of tests because tests are more available, and because there's an increasing recognized public health need for testing. Using tests for public health reasons is not what medical clinicians are trained first and foremost to do. They're thinking about what do I need to do for the patient in front of me, not what are the epidemiologic questions that are existing out in the community, and how can my test or treatment impact those big epidemiologic questions. And so we're trying now to keep our mind both on the public health epidemiologic questions while also taking care of the person in front of us, which is a little bit unique for a lot of doctors, nurse practitioners, and PAs.
That's a great answer, Jackson. I think that's a really important difference that a lot of people have not thought about, and I had not thought about till a couple of weeks ago. So thank you for explaining that. Joel from KXXV, do you have a follow-up?
Yes, as far as, like he said, testing goes, I just received a question from one of the viewers who asked that we hear about active testing going on, but is there going to be any tests that will tell people if they have ever been infected?
Shall I take that one, Mayor?
Sure, please do, Dr. Griggs.
So we do expect that the IgG test, now there's two antibody tests, there's IgM and IgG tests. So the IgG test, which only becomes positive 2 weeks after symptom onset, that test, particularly once the characteristics, the dynamics of the test get better and better, that test is going to be very valuable and very likely to communicate immunity. In other words, if you have it, we're expecting that the studies will show that a positive IgG, once the lab technology is what we need it to be, will communicate that a person has had the virus and is now immune. That technology exists for other viruses that technicians and researchers have had a lot of time to test and explore and confirm the quality of the test. This virus is so new that there's a lot of work being done right now to get the right test and the right testing technology that can communicate that information accurately. Again, like I spoke to before, what we're really trying not to do is to give someone a test and say, congratulations, you're immune, and send them into harm's way, which would obviously be a devastating thing to take place.
Thank you, Dr. Griggs. Shaquille Amari from KWKT, do you have a final question? Shaquille, are you there?
Shaquille, are you there?
I do not have a follow-up question.
Okay, he does not have. Yeah.
Thank you very much. I want to thank all of you from the press for being here, asking good questions. You all always have good questions, and it's so important that we get correct information out to our public. I just appreciate all the great work that the Waco Trib has done towards that, and the TV stations, both with your news programs and your morning shows. That's going to be even more important as we move into reopening our economy. So thank you for your work.
We're ready to wrap this up, Mayor, if you'd like. And if you'd like, we can make closing comments. And if you'd like, if it's okay with you, I'd like to ask Dr. Griggs to go first, followed by by Judge Felton, and then you can make the final comments.
Great, thank you.
I'll keep my comments short, and that is to remind the public that while our focus right now is on the novel coronavirus and the disease that it causes, COVID-19, there is still a lot of chronic disease out there. 600,000 people die each year in the United States from heart disease, and another 600,000 die of cancer, and then stroke and chronic lung disease and cirrhosis and chronic kidney disease and all varieties of other ailments. While our first move was to say all non-essential visits don't come into the clinic, we're now beginning to shift towards carefully bringing people back in for the care that they need. And I think all of the clinics in town have come up with ways in which patients can receive care in the safest, lowest risk manner. So we would just encourage you, if you are someone who has diabetes, particularly out of control diabetes, hypertension that's not controlled, history of heart, lung, liver, kidney disease, and you're on medications for those diseases, please reach out to your primary care clinician, check in, see how they would want to treat you to make sure that you are staying healthy, and don't be afraid of healthcare. Recognize that we've all put into place ways in which we can serve you without putting you at risk.
Thank you, Jackson. Judge Felton.
Yes, just a few closing remarks. One, we talked about how many businesses have been affected financially, and of course, with the city and the county, there's an impact there too. Probably more in the future with revenues, depending on what values do with real estate, income property, those things, and how that'll end up, what's going to happen to the tax base. And I think it's important to know both the city and the county have tried to really be good stewards of the budgets, and will continue to do that. It's a time that we feel very glad we made decisions on keeping a strong fund balance to be able to weather these storms and try not to have knee-jerk reactions to them, to the public insofar as the tax rate and the total taxes to hit them, because this is not a time for them to take on additional expenses either. So we very judiciously are looking at that. And to the individuals, I just say what Winston Churchill said: when you're going through hell, don't stop. And so we will. We need to keep going, and we need to keep doing what we've been doing to get out of this thing. So that's my little bit of words of wisdom to the community. You're doing a great job. Thank you so much for all that you're doing.
Thank you, Judge. And I really want to thank Judge for his great leadership of the county and the Commissioners Court through this trying time. We couldn't have a better leader in the county. And thanks to Dr. Griggs for taking your time to not just for this press conference, although preparing for the press conference takes a lot of time, just the work that you've been doing to help us navigate this is greatly appreciated. I want to thank our city staff for this press conference, particularly Larry Holsey and Esmeralda Hudson and their staffs. As I mentioned earlier, I mean, it's so important for us to try to get the correct information out at this confusing and trying time. And our staffs have all been working really, really hard on that. I want to wrap up by again asking for your prayers for first responders and hospital workers and for their families. They are all under a lot of stress right now. Ask for prayers for the families of the victims of this, both those who were hospitalized and suffering and those who have passed. I want to say one more time, thank you to all of our citizens for the great work you have done to get us to a good place in our county where we are ready to begin reopening our economy. And I feel like I must remind you one more time how important it is that we continue to follow safe practices as we move forward. And say again that you are responsible for keeping yourself safe as well as keeping those around you safe. If you enter a business or place where you don't feel safe, then leave. Don't expose yourself to that situation. I want to apologize for my dog Scout's entry into the press conference earlier. I'll try to find a better place for him next time. Take care of yourself and take care of one another. We will get through this together. Thank you.
Thank you, all three of you. Thank you all for giving the time and the energy you are, not just for the press conference, but for this. Our citizens are better off, and that's the reason we're doing better than so many other communities, that we've got the great leadership and they're hearing what you've said. Thank you for being with us, and thank you for everybody, and that's our afternoon off. Thank you.
Thank you.